Good evening, everybody. Welcome to McLean and our McLean and Me educational series. Thrilled to see so many faces and some familiar faces. We're excited about this event, Navigating Insurance. We have a great panel, and I'm interested because I want to learn as much as you all. So, I'm Jameson. I'm the VP of Marketing and Development, and I'll be moderating. This evening, we'll go through the three panelists, and then we'll kind of try to save questions and answers for the end, if that's okay. Just want to do a couple house cleaning items. Next Tuesday, November 15th at 6 to 7 at the Health Center, we're having an open house for assisted living. If you're interested, come by and we'll give you a tour. Our next McLean and Me event will be December 8th. There are RSVP cards, and you can RSVP tonight if you wanted to. It's a day in the life of a resident at McLean. Over on this table, you'll see some collateral pieces that may be helpful to you. There's some business cards and some just information that you might want to take. I'm going to introduce our three panelists, and I'm going to give a quick bio on the first one, and then when it's Tully's turn, I'll give a bio on Tully, and we'll go from there. So Michaela Biglione, is that right, Michaela? Close enough? All right. Has been with McLean as Director of Admissions since 2019. Prior to McLean, Michaela served as Director of Admissions and Marketing at LTC Community in Danbury. She has an in-depth real-life experience with multiple facets of senior care, such as Medicare, Medicaid, and managed Medicare. Is that right?
Yeah.
All right. She has a passion for senior care and appreciates the opportunity to help families make the right insurance and placement decisions. So I'm going to start by teeing up Michaela with a couple questions. What insurance do I need to make sure I am accepted in rehab?
So, in rehab at McLean, we take a variety of insurances, including Medicare, Medicaid, and we take managed care insurances as well. We have contracts with Aetna, United Healthcare. However, with United Healthcare, there is a caveat. You do have to be a state retiree at this time. That is the only United Healthcare managed care plan we take. We also take Cigna, Care Partners of Connecticut, Harvard Pilgrim, and Anthem Blue Cross Blue Shield. So any of those would make you eligible for any sort of rehab services here at McLean.
Perfect. How does bed availability work?
Bed availability can be very tricky. During COVID on our post-acute unit, what we did is we made all the rooms private because we felt as though that was the safest way to take care of our patients and our residents. So we have a very small rehab unit right now, only about 21 beds. So we have discharge meetings twice a week to determine what beds will be coming open as patients discharge. And it's also important to keep in mind that any patient living on the McLean campus will get priority admission to post-acute care from the hospital or from the Burkholder or assisted living or here at the Goodrich over other patients in the community. So anybody living here at McLean does get that priority, which does factor into bed availability for patients in the community.
Okay. Do I need to stay a certain amount of days at a hospital before coming to rehab and have it paid for by Medicare?
So with Medicare, typically you have to have their traditional 3 midnight rule, which is you need 3 midnights inpatient at a hospital. And it's important to remember that they could maybe admit you to observation, but that is not considered an admission. You have to be admitted as an inpatient for 3 midnights. However, in the past 2 years, due to COVID-19, they have released what's called a disaster waiver. So it's still ongoing at this time, meaning those 3 nights in the hospitals are waived. So you do not have to have 3 nights in the hospital at this time to receive rehab at a skilled nursing facility. However, Medicare can terminate that waiver and give each state 90 days notice. So at this time, it's extended until January 17th, 2023, and we will see if that continues. If not, we will revert back to the traditional 3 midnights in an acute hospital setting.
Thank you. And this one looks like a nice discussion. So managed care versus traditional Medicare, what's the difference?
So,
I'm not going.
so with managed care and Medicare, there are advantages to both. Typically with Medicare, you're paying higher out-of-pocket premiums per month. However, the coverage you get when you need it is much better than with the managed care plans. With the managed care plans, you do pay less upfront per month. However, it does limit you to what primary care physician you can use, what specialty physicians you can use, and what facilities you could go to if you did need a rehab stay or a long-term stay. So it's really important to keep in mind that when you are picking a plan, pick a plan and look at it as if it's going to be an emergency situation. Because in most cases, when patients need rehab, it's an emergency situation. So with managed care plans, those particular plans, whether it be United Healthcare, Anthem, they have to give you prior authorization to come to any sort of rehab. And with Medicare, as long as you have that 3-night stay or the waivers in place, there's no prior authorization needed. And then once you come to the facility, the insurance company dictates your length of stay. And with Medicare, you do tend to get more time covered than with the managed care plans. And I only say that because that's part of what I do every day here, is try to get those insurance authorizations extended. And to be honest with you all, it's very difficult with the managed care plans to get any sort of care extended past what the insurance company says on admission. So, you know, you have to do what's best for you and for your family, but just keep that in mind when, you know, comparing Medicare versus Medicare Advantage plans.
Thank you, that was helpful. So another big one, cost versus coverage. Does paying a higher or lower premium change your coverage?
Again, it depends on the plan, but with Medicare and the higher premium, I personally feel as though you get better coverage when you need it. With the managed care plans, it is less upfront, which is nice, and if you're just having regular preventative doctor's visits, then it's a really great plan. However, if an emergency happens and, you know, there's a cardiac event, an orthopedic event, COVID even, you really want to think about what your coverage will be in those acute situations, and typically Medicare Part A pretty much cover everything at 100%, both at the hospital and at a skilled nursing facility, and that's not always the case with the managed care.
Thank you. So managed Medicare and skilled nursing, how do prior authorizations work?
So prior authorizations work by originally to come to a facility, the hospital will send over your medical record to the insurance company. An insurance adjuster will review, take a look at it, and they will decide whether or not you need rehab. So that's something to keep in mind, that there is someone making that decision. Not only can you go to rehab, but for how long.
Yeah. Why is it important to double check your policy versus facilities you're interested in?
So this happens all the time. Unfortunately, to me, I'll get calls in the admissions office of, we really want my loved one to come to McLean, but they have X insurance. And I have to say, unfortunately, we're not in network with that insurance, therefore this is kind of a non-starter. You know, if we don't have a contract, unfortunately, insurance is not gonna pay for you to go to McLean. So when choosing a plan, make sure if you have even primary care physicians might not be in network with some managed care plan. So just when you are picking that plan, make sure you have an idea of what facilities you may want to go to in the case of an emergency, and just make sure your plan contracts with those facilities. And that's as simple as giving that facility a call. Here at McLean, we do have flyers you can take home with the insurances that we take, and you can always call us in the admissions office.
Perfect, thank you. Is there anything else you want to add, Michaela, or you want to wait for questions and answers? Or?
I do want to add one thing, and that is I'm very passionate about also getting a secondary insurance. whether it be an AARP or a Blue Cross Blue Shield plan. A lot of people don't realize that if you're in a nursing facility after day 20, Medicare, and in 2023, the rate has gone up to $200 a day as a copay for every day that you're there up to day 100. So that can be very costly, and that is all out of pocket. So the Medicare supplement plans like AARP and Blue Cross are designed specifically to pick up those copays. Therefore, the idea would be your entire post-acute stay would be covered at 100%. So just keep that in mind, that there are copays, and that supplemental insurance is extremely worth looking into.
Perfect, thank you. I do want to remind everybody too that we're neutral in this, and that
Yes.
we want to make sure we're not saying you should choose this insurance or that insurance. We're trying to be a resource for everybody because we know how difficult it is. And as we're going through this process, write down questions, because I really think, unlike the first one, which was on memory care, and the panel went on almost the entire hour and a half, this one's going to be more about answering your questions and what questions you have. So, our next speaker is Tully Meyer. Tully has been with McLean for 5.5 years as the community liaison for home care and hospice. Before working for home care and hospice, her experience was in skilled nursing homes as a conservator. Before that, Tully was a lawyer, but don't hold that against her. All right, Tully. What are some of the least known benefits of Medicare A and B that would be useful for the audience?
Well, I think it has a lot to do with what kind of service you're looking at. I did up a quick little reference guide as to like what is typically a Medicare A covered benefit and what's typically a Medicare B covered benefit. The nice thing is, I mean, I know there weren't a lot of upsides to COVID, but one of the upsides is that a lot of new businesses came into Connecticut that service people in the homes, and that they are covered by Medicare also. And that would be there's an urgent care that will come into your home. There's a wound clinic that will come into your home. Typically they work with us. Obviously home care will come into your home. I think this kind of is, on the tail end of just home care in general, people not really knowing how Medicare A and B and, management Medicare as well can benefit folks in the home without having some kind of a hospital or rehab stay. So that's a little bit of a hidden treasure also. So it's kind of a short answer to this question, because it all depends on your situation. And I did find a great app today that one of the nurses in the agency showed me, and it's called What's Covered under Medicare. That's actually the name of the app, and it's so cool because you can download it and literally type in, like, you need a prosthetic, is it covered? And it'll tell you whether it's covered or not. Does Medicare A cover it? Does B cover it? So that is a fabulous find, like last minute find for us today, because it will make it easier for you to know. Because Medicare is really, traditional Medicare is universally accepted. I know that my mom has had an issue here or there with a primary care physician who doesn't take Medicare, which is unheard of, but in any kind of an active medical treatment type situation, Medicare is still the gold standard.
Perfect, thank you. One of the things I do want to know is, I think we have everybody's email, so things like the app that Tully just mentioned, we'll send that in a follow-up email. We'll send a link to Choices when we introduce Urania. We'll send a link to her organization as well. But if you want anything, you have our email addresses too. And we're just looking honestly to be a resource for everybody in the community. So, all right, Tully, how does home care and hospice benefits work with Medicare if I stay in my home?
Well, just on the tail end of what you had said before about our contact information, if you have mine, and I'm happy to give you a card as well, please feel free to reach out to me anytime, and if I don't know the answer, I will find the answer within McLean or within the community in general, because again, it's so hard sometimes to give good information because every person's situation becomes so nuanced when they're in it. And so you just may have a question that's kind of an outlier but it pertains to you. So please feel free to use our contact information that way. And so, let's see, home care and hospice benefits work. There's a lot of misconceptions about it, but let's go with home care. So home care is the service that you get, which is covered by Medicare. It's skilled home care versus home care, which a lot of people get confused because it's incredibly confusing. That home care is the private duty component, where it's help with your ADLs, it's your grocery shopping, it's helping with laundry and that type of thing. That is not the service we provide. We provide the skilled service, if you will. So it is insurance driven. It requires a doctor's note or a hospital stay. We often get referrals from skilled nursing. So you get home care coverage. Like, we had a lot of people get it as a result of coverage as a result of COVID because they just weren't out and moving like they were. So if your physician thinks you've had a decline in health, even if it's just physical therapy, we can come into your home. The conditions are, though, that you must be homebound, which does not mean you need to be bedbound, but it does mean that it's a taxing effort for you to leave your home at that time. So we're intermittent insurance. We come in when you need us and we pop out when you're better, or intermittent services. So as long as you're homebound, you can still go get your hair done, go to church, that type of thing, but like I said, a taxing effort. And you have a skilled nursing need. So putting a Band-Aid on would not be a skilled nursing need, but you have a new medication, it's really confusing, it's complicated with the regimen you're already on. A nurse can come out and oversee that and kind of get you acclimated to it. A therapist, physical therapist, can come out and just get you a little bit stronger. An occupational therapist can help you, you may have a new restriction. So an occupational therapist will show you how to go about your daily activities with this new restriction and do it effectively. So, am I missing anything, Peggy? My administrator is here. Pardon me?
Home health aid.
And a home health aide. See, thank you very much. Right, so it's limited because insurance, again, does control how much you get in a home health aide, but you will get a home health aide to come in. Sometimes we'll pair them up with the occupational therapist so they can be doing the physical work while the occupational therapist is kind of guiding the situation. But yes, the home health aide is also instrumental, and they can do light chores while they're there, but mostly they're there to help you with ADLs. And once you're better, we're out. If you need more assistance, that's perhaps when a private duty component would come into play. So that's home care. And then hospice. Hospice, I think probably the biggest misconception about hospice is that it's round-the-clock care when you're in your home. And hospice is the benefits of hospice, that you have a nurse to oversee your care, so you have additional set of eyes. We also have our own medical director. We can adjust medications faster. It's certainly, our specialty. And so it's not round-the-clock care. We do offer, it typically doesn't come with any physical therapy. Sometimes, and it doesn't really typically have occupational therapy. It's designed for comfort, which doesn't mean anything happens any faster, but what we do see is, well, first of all, people do graduate from hospice. And second of all, is that once our nurse comes in and the medical director, and they look at your medications and they determine which ones you really need, that people just feel remarkably better. Because we know all medications have a side effect, right? So somebody might be on 15 medications a day. That's not unusual. And you can get rid of 10 of them because they're not life-sustaining, and people wind up feeling like $1 million. And then somewhere in between, which Medicare also does cover, is a service called palliative care. So it's a home care benefit, and it's not hospice, although people confuse them and use them interchangeably. Palliative care is when you have a chronic illness or a potentially terminal illness, but you want to continue to seek treatment. So you have the oversight of our agency, but you're still going and getting chemo and doing the things in that way you want to do, but at least for pain management and also for social services, that we also do offer social work services with our agency. And that's not, like, everybody always thinks social work, I'm a social worker, but a social worker is really a resource coordinator. So in addition to being a social worker, they will tell you all the resources that are available in your community, can link you up with them, can bring services in that would be a support to you. So to me, I'm not gonna say it's crazy, but if people forego their home care benefit or their hospice benefit, it's just like, it's a benefit that you have earned your whole life and you've just decided not to use it.
Thank you.
Sorry, long-winded.
No, that was.
It's complicated.
Yeah. So last question, tell us about some of the misconceptions when it comes to home care and hospice and insurance.
Oh, okay. Well, I kind of went over that a little bit in my last answer, but misconceptions being, you know, I'm too young for home care, or a big misconception, of course, is that hospice makes death come faster, which is not the case. Just makes people comfortable so they can relax. And the misconception about hospice being kind of a 24-hour type care thing, you can call us 24 hours. You can always reach a nurse on call 24/7, but there's not somebody in the home with people. And the insurance thing, I'm gonna just double down on what Michaela said, and that is, if you can afford it, Medicare is the gold standard. The managed care products absolutely serve a purpose. If you're on the younger side, if you're healthy, if financially it makes sense for you, it really makes a difference. Sometimes I do think that these insurances are a little bit oversold, and that as we get older, traditional Medicare is just so much more widely accepted, so you do get the choices you want in terms of, like, an insurance company may or may not grant us a contract. If we don't have a contract, you can't have us. That's choice limiting. If you have Medicare, traditional Medicare, that is far less choice limiting. So that's, we kind of operate a similar way in that we run the insurance policy. If we take it, we take it obviously, and it's kind of black and white.
Perfect. Well, thank you so much, Dolly.
Sure.
All right, now Urania Reyes Rivera is the regional coordinator from Choices in Hartford. Choices is Connecticut's state health insurance assistance program. They empower, educate, and assist Medicare eligible individuals, their families, and caregivers through objective outreach, counseling, and training to make informed health insurance decisions that optimize access to care and benefits. This is kind of what Tully had said, is let's use our resources, and we're so excited to have you, so thank you for coming, Urania.
Thank you for having me. So my name is Urania, and as he said, I'm the regional coordinator for the Choices program. I'm sorry, can you hear me now?
Yeah.
Okay. So the Choices program, known as the State Health Insurance Program, what we do is we provide unbiased information to the consumers in the community. The state of Connecticut has 5 agencies on aging. The Hartford one that covers the Hartford and surrounding towns, including this town. We mainly work with the individuals or their caregivers. Any health insurance related questions. They had very good answers. So pretty much all the information that they gave you, we will give that information as well. We do have a lot of connections within the state of Connecticut. Our agency is a nonprofit, so some of our funding are state and some of our funding are federal funding. We like to work in the community with what we call volunteer host organizations. So that means that we have trained Choices counselors in example facilities here. If we can get a trained person that will do the Choices work and educate you on any Medicare related assistance that you need. However, the Choices program goes a little bit beyond and above because we have all those extra connections at the state level. So, for example, this facility takes Medicaid and takes certain kinds of insurance. If you're having, at some point, there's a barrier where the insurance company doesn't want to provide some of the services, but it's medical necessary. When it comes to Medicare, the word that we like to utilize is it's medical necessary. So as long as it's medical necessary, the Choices program has the ability to get in contact with the proper agencies and fix those issues for the consumer. So if a person has Medicaid and is having an issue, then they will contact me and I will contact Medicaid directly and I will have that fixed itch. We have connections with the Social Security Administration, and a tool that we have that I have access to the tool, not everybody does, but we have what is called complaints tracking module. So when you call an insurance company for a services or for a medication that it's not covered here, the insurance company gives you the runaround. Have you calling, have you speaking with a representative, and then you go to the pharmacy, for example, for medication, it's not covered or they didn't do their due diligence to actually fix the issue. We only need one interaction that the consumer or the representative for the consumer made, the date, the time, and the name of the person you spoke with. If it's not fixed, you will send us an email and we will enter it in the complaints tracking module. That gets the issue resolved in less than 24 hours in some cases, depends on the urgency. It does not take more than 72 hours. So those kind of connections and those kind of issues can be resolved through the Choices program. Again, it's an unbiased, so we do not work with any insurance company in a specific. All of our services are for free. We provide more than just health insurance as well. We do information referral, so we will be a point of contact and a resource coordinator as well. We will contact you with the agencies that will provide specific services. We don't do specific case management. However, our agency has multiple programs, and there's a couple of programs that will provide case management as well, depending on your need. I guess, you know, we are the main course in a lot of situations. Exactly. A lot of people, I don't know if you guys are familiar with 211. 211 is the tool that Connecticut uses for assistance. When you tell them that you're over 65 or that you're disabled, they will automatically transfer you to Choices. It doesn't matter what agency it is, they will. So we're kind of the 211 of the elderly and disabled, which is pretty good.
What challenges do you see come across Choice, or what are some of the most difficult things that you see from a consumer standpoint when it comes to, can you give advice on which insurances to take, or is it based on individuals?
So we can give you a comparison report utilizing the Medicare Plan Finder tool. We can educate you on, you know, what's the cheapest option, what's the option that's going to cost you more money. We can provide you, as she mentioned, if your doctors are in the network, we can see if the medications are part of your formulary. We can give you a comparison, but we cannot recommend a specific plan. We work that we will always provide you the 3 cheapest options for the consumer based on their medication. Skilled care is very expensive. However, you don't require skilled care all the time. So the most expensive thing when you're on Medicare is prescriptions. Prescriptions, unfortunately, their co-pays can be, and if you take a lot of medication and you go into the coverage gap, it will be very expensive for you because you're gonna have to pay a lot of out-of-pocket costs. We have seen it personally. I have had consumers who unfortunately have to pay over $10,000 in 3 months on medication because if they have a chronic illness, it will do that. So that's, you know, that's what we can give you. A lot of the challenges is the prescription. There's a lot of individuals who sometimes sign up with insurance brokers or insurance company directly, and one medication can make the difference because that one medication can cost you $200, $500 a month. The good thing is that, during the years, the federal government is actually seeing these challenges, and it's actually putting in place a lot of things. Starting 2023, they have the insulin program. It was a pilot program that came out last year with some plans that you cannot pay more than $35. Now it's an actual program within all the plans, but there's some requirements like everything else. So I think, you know, if you think you might benefit from that and your current plan doesn't provide an option, you can contact the Choices program and we will help you with that.
That's great. All right, so I think just before I open it up to questions, I do want to just remind everybody there are surveys on your table. We ask that you fill them out because this is a series that we just started back up. This is the second in a monthly series that we're doing. We're going to add some more, but we really want to hear from you. We want to hear what the community wants to hear from us. Again, we want to be a community resource. So we got some really great ideas after the memory care session based on our survey. So let us know what you want to hear about in topics. That being said, I will open it up for questions. Just raise your hand and then, yep, I'll go.
Well, I have a question for you, Rainey. I believe my husband and I signed up for Medicare. We've been on Medicare since when we were 65. But we dropped Part D because we didn't need any medication. Guess what? That's changed. Because that was 20 years ago, and now I have asthma, so I have to take inhalers, which are $300 and something a month. So, you know, that's getting a little pricey, but I understand to join Medicare with Part D, that's very expensive too. So maybe you can, or any of you can tell me what's the best thing, to keep paying out of pocket or to pay a premium to get into Part D?
That will depend on how much your penalty will be.
Yes, I know, I realize it. How do they decide that?
Social Security, well, the Part D penalty is a 1% for each month that you didn't have it. So, but it's based on the standard prescription premium right now, which is $36.50 if I'm not mistaken, and I do apologize if I didn't get that correctly. So what they're gonna do is, for example, you didn't have it for 24 months. So whatever plan you choose moving forward, the cheapest one is $6.80 for next year. For example, you will get the $6, however, 24% of the base premium of the $36.50 is going to be added to that $6.80. And then the coverage will be based on the medications that you take. The co-pays and deductibles, once you're in the plan, they're not gonna be higher because you didn't have insurance for the period of time. When we do the educational sessions, I always make sure to tell the consumers always the cheapest plan. We cannot tell you exactly what plan it is, but I can tell you the price. Why? We always advise individuals to at least enroll in the cheapest plan, because then you will avoid penalties, because unfortunately I've seen that a lot. However, we have some resources that if you want, you can take my card and I can help you directly with the names of the prescriptions. There's a lot of manufacturers that actually provide prescription assistance, and you can have up to a 400% of the federal poverty level income limit. So that's a very high income. And it will give you, I've seen cases where the consumer has paid not even $200 and has a whole year supply of medication. But that's directly with the manufacturer. There's also programs like Good RX and Meaty Meds. So definitely feel free to contact Choices, contact me, and if you have any other cases like that or know somebody else, we can definitely help with that.
Do we have your phone number?
My business cards.
Yep, we have the business cards on
Okay.
the table
Okay.
here on your way out. And if we run out, we'll be sure to email Urania's email
Thank you.
address too. Okay.
We've had long-term care for quite a while, and we're, you know, as it's increasing, we're hoping we get our money's worth out of it. But I need to know how it connects with what you're talking about as far as what's offered at places like McLean.
Did everybody hear the question?
No.
Okay, so, repeat it one more time, and I'll say it over the microphone, how about that?
Having long-term care for a while, quite a while, I need to know how it fits into the programs that are being offered and mesh with Medicare, Medicaid, and if indeed it's worthy of keeping or not.
Did everybody hear that? Because I'll give the microphone. Okay.
It must be a hot topic, no one
Well,
wants to talk about.
No, it's
Both
not
do,
that.
that's the thing.
It's
just-
good,
it works
it's
two
good to
different
all,
ways,
yeah, I think it's great, and we can add.
Oh, you want this? I could project, but let's not
I
do
feel
that.
like I could yell.
So I believe that long-term care insurance is incredibly valuable. Because, for example, here at McLean, even our assisted living, correct me if I'm wrong, does take long-term care insurance. We welcome it, because for us, that's considered almost like a private pay situation. Because the insurance, typically what happens is the long-term care insurance company will send a check to you, and then that's given to us, or you could sign it right over to McLean. There's a couple different ways that we can do that. But it does come in handy. Just know that it not only covers long-term care, and that's 24-hour nursing, residential in a facility, but it also will cover assisted living. So if you're not quite ready for long-term care, but you feel as though you're thinking about, maybe I need more assistance, maybe we need to move into a smaller apartment in a facility that has other resources for us, the long-term care insurance will pay for that. And if you want to take that on home care.
Yeah, as long as you need assisted living services.
Yeah.
So I just always recommend to people, look at your long-term care policy every now and then, because people often don't read it until it's crunch time, and there's often a 90-day waiting period. So if you're needing little picky things in your home, so how it would help you if you're in your home still, is that we may come in and provide what we can, but you may need more help than that. You may not be fully in need of like 24-hour care or somebody in your house all the time. But we say activate it. Look at your policy, see what's required for it to activate. And you can get like a homemaker and companion sometimes to activate it depending on the verbiage in your contract. And that way, by the time you really need it, it's already activated. And so then you can really maximize it. So that's my
It's
2
worth
cents.
keeping for a little while longer.
Yes.
I think it is, it's like anything, it's like disability insurance or
Yeah.
anything else, it's kind of a gamble.
Right.
But I think it's a good gamble because it leaves you with options to have that kind of in your back pocket. Even, let's say, we all say, God forbid, we should need skilled nursing, not McLean. McLean's awesome. But everybody feels that way, right?
Yeah.
Yeah. That you can go where you wanna go with a long-term care policy because you're like a private pay, yeah, resident there. So it definitely increases your options.
Okay, in the back?
Years ago, they used to say that if you bought managed care product, you wouldn't need secondary insurance. So I'm old enough to remember that. Aside from long-term care insurance, what other secondary insurances are you looking at if in fact you have, managed care and it's supposed to cover everything forever to $1 million? That's not true anymore?
Yeah, I was right.
I'll go to the expert for that.
So when they used to say that if you have a managed care, you don't need a supplemental, is because managed care / Medicare Advantage plans is a supplement. It acts like a supplement in a different type of way. So there's Medicare Advantage or Medicare managed cares, and then there's supplemental policies that are the ones that cover the extra % that Medicare doesn't cover. So when they're referring to that, it's that okay, so there's traditional Medicare and then there's Medicare Advantage plan. Traditional Medicare it's accepted everywhere. There's not so many restrictions and like sorry. mention, you know, you get a lot of more benefits paid for. And then there's the Medicare Advantage plans. They provide everything in one. So Medicare, it's divided in hospital, doctors, prescription, and supplement. Managed cares or Medicare Advantage plans, they provide everything in one. And then they just give you the option of paying certain co-pays when you go to the doctor. Supplemental policies in Connecticut right now, that will be an extra option for you on how to pay for those Medicare services that you have to pay out of pocket with your 20%. In Connecticut, supplemental policies are standardized. So that means that it doesn't matter what company it is, what provider is providing it, or how much are you paying for the company on a monthly basis. If you have, for example, Plan N, I could have Plan N and you have Plan N. I have it with one particular company. I'm paying $1,000 per month. You're paying $250 with a different company. Just because I'm paying $1,000 does not mean that I'm going to get any extra benefits paid for by that supplemental policy than the one that you're paying $250, because it's standardized. So that means that doesn't matter what company is offering, as long as it's the same plan, because they're different plans when it comes to supplemental policies, it will provide the same coverage.
So that's allowed?
What?
Like one insurance company could charge so much more for the same plan?
Unfortunately, it is. Right now,
So they just asked, is that allowed and legal to have the same insurance and such a drastic price difference? And the answer is,
what I advise to the consumers always, because we all have preferences, you know, sometimes we just know a specific company. For example, I've been with the agency for 10 years now, and I've had this specific company for 10 years now. It's worked wonderful with me. I don't know if by the time I'm 65, I only want to take this specific company, not because everybody else has it, not because it's provided me the most inexpensive option, just because I'm familiar with it. So familiarity makes sometimes things a little bit difficult. And I have consumers who are paying $1,000 and something for supplemental policy because, you know, they've been with that company for many years. And yeah, so it's like I think everything else. Sometimes you have your doctor, you have a plan right now, your doctor suddenly doesn't take the plan anymore. Sometimes I've seen it, consumers either switch policies. They will choose a different Medicare Advantage plan just to keep the doctor.
And can you do that like mid-year, switch your, like if your doctor no longer like takes Anthem, do they have to do it annually, or can they do it like in the middle of the year?
so the question was, can you switch mid-year your policy essentially,
Okay.
right?
It all depends. If you have traditional Medicare and you have supplemental policies, then yes. In Connecticut, there's continuous enrollment. All the information that I provide is in Connecticut. Each state manages their policies and enrollment policies differently, and they have different enrollment periods. When it comes to supplemental policies on itself, yes, you can switch from one company to the other or from one plan to another plan within the same company anytime during the year. However, if you have a Medicare Advantage plan and you do not have state benefits like the low-income subsidy for medication or Medicaid or other state benefits, you can only switch from Medicare Advantage plan to either a different Medicare Advantage plan or to go back to traditional Medicare during the open enrollment period. The annual election enrollment period, we call it open enrollment period, which is the period that we're currently in, October 15 until December 7. And then any changes you make during this period is going to be effective January 1st. However, 2 years ago, there was a new enrollment period implemented, which is called the Medicare Advantage Plan Enrollment Period, January 1st to March 31st. Any changes you make, if you make a change in January, it's going to be effective the first of the following month, so it will be effective February 1st. However, You can only switch from one Medicare Advantage plan to another. Or you can make the decision to drop Medicare Advantage plan completely and go to traditional Medicare. If you enrolled in a traditional Medicare in October, and January comes and you are in traditional Medicare, and you suddenly decided that you want a Medicare Advantage plan again, unfortunately, you will have to wait until the new annual election period, because that's not allowed during the Medicare Advantage plan enrollment period.
Okay, you raise your hand first. Sorry.
I have a question about that. So if you enroll in the Medicare Advantage plan, you're losing basic Medicare? I thought you kept A and B, and that the Advantage is your supplemental.
Okay.
Urania, can you repeat the question just in case everybody didn't hear?
She wants to know that if you enrolled in a Medicare Advantage plan, if you lose regular Medicare A and B, or is it just supplemental?
Yeah, right now during the open enrollment.
The open-
Right.
No, so in order to enroll in a Medicare Advantage plan, you have to have both parts of Medicare, A and B.
Okay.
You do not lose A and B because Medicare Advantage plans are private insurance companies that are there to provide the same services that traditional Medicare covers. It's just that their Medicare dollars are being managed differently. That's how we are told, it's how it's being explained. You do not lose anything when it comes to A and B, which is A is hospital and B is doctor's insurance. It actually might benefit you if you don't have a chronic health condition, because you're gonna get, Medicare Advantage plans are required by law to provide the same coverage that Medicare will cover. However, their co-pays can be different. And in some cases, they can have extra benefits, like dental, hearing, vision. Most Medicare Advantage plans sometimes do not require the 3 in-hospitalization stay in order to get skilled care. So that's one of the advantages, that when you go to traditional Medicare, as she mentioned, right now because of the pandemic, everything changed and it's not a requirement, but we only have the date of January. We don't know if when January comes, it's going to
Are
go
they
back
gonna
in effect.
extend it, right?
And I will say this, based on our meetings and previous informations, I am thinking that it's going to be stopped as of January, because right now they're stopping, they had the public health emergency for individuals who had Medicaid and then suddenly became Medicare eligible. Those things are stopping, so now they can switch you from Medicaid to the Medicare Savings Program. So there's a lot of things that are coming back into place. They're just being a little bit subtle about it. But I think it's coming to an end.
Urania, is that gonna help the consumer, confuse the consumer, or hurt the consumer?
Well, it all depends. It could, you know, if the consumer is not educated on the process of having the 3 in-hospital stay in order to have the rehab services covered, it will affect them. However, you know, I personally, I'm one of the main persons that do the outreach for the North Central region, so I try to do as much as I can to do that, to do the education. I think the more we educate consumers on it, they can be aware. I will recommend that even if you don't remember everything, if you encounter yourself in a situation where you have to go into the emergency room, into the hospital, make sure you give a phone call to somebody else. Why? They give you the notice if you're in observation or inpatient when you're in the hospital. I personally, if I had a car accident and I'm going to the hospital, I don't want to be reading papers. I'm in pain. Who wants to be reading papers in pain? Make sure you bring somebody else, because that other person can read those papers for you. And when you feel a little bit more comfortable, then you can make the decision, because you can make the decision if you're not satisfied with being in observation status, then you can start the whole process of appealing that. But yes, it's just, unfortunately, if they're not educated on it, it's not gonna be beneficial for them. But if they get the right education, I think it will be,
You can advocate for themselves.
yes, they can definitely advocate for themselves. However, I have to emphasize again, you can call choices.
Yeah.
And we will do, something that we do is we do a lot of advocating. And I personally, and will say I'm very proud of it, in the agency, something that I most love about my job is advocating. Like, it's just, I think that I've been doing it for so long, I can't resist myself. Last week I was at the pharmacy. There was a lady who couldn't afford her medications, they were over $200. And if the pharmacy, it had over like 10 people waiting, so the pharmacist kind of seemed a little bit rushed. And I just stepped in and said, hey, can you offer her the Need Meds prescription assistant program? So she was able to pay, she paid like $150. So I love the advocacy, so we're very strong in advocacy at NCAA, so we will definitely help you with that.
No.
Sorry.
Oh, no, go ahead, Kelly.
The takeaway there, though, is if you do land in the hospital for some reason and you do have traditional Medicare, check to see if you're actually admitted or you're in observation, and then advocate for your 3-night stay after January if this goes back into effect, because sometimes a little squeaky wheel works, and or you may be admitted and they keep you for 2 nights and they're gonna discharge you to post-acute for, that night. Just say, can you just keep me another night? They'll find a way if it's a,
And we also
I'm
advocate
sorry,
for that
yes,
as well.
right. If you have a good, strong relationship with your doctor, even though you see hospitalists in the hospital, they can help you advocate for that as well, because it makes a big difference in terms of how much is gonna be out of pocket for you.
Okay, Millie.
So, this has been very helpful. This information, so Urania, I'm asking because we haven't changed our Medicare insurance since we signed up for it. We don't know whether we're in the right plans or not. And with the barrage of advertising and commercials that are out there, nervous not to try to connect with any of them. Are you the right person for us to know? And what do you need to know from us to know if we have the right plans?
Hold on one second, just want to make sure, did everybody hear that question? Okay, so there's a lot of choices, there's a lot of commercials, and I can relate to this because I'm helping my dad and it's overwhelming. I'm afraid to almost engage with some of those advertisements. And Milton asked if Urania would be the right person to kind of reach out to and learn more about that process.
And then what would you need to know? What do we need to bring or provide you with to help understand what plans we are in, and is there something else we should be doing?
Yes.
And then what information to bring to Urania so that she can make the best choices.
Yes. So yes, we will definitely be the point of contact for that. We will need very minimal information. A list of your medications will always help, because that's, like I mentioned, that's the most expensive thing during the year, so we want to make sure that your medications are covered. If you get any state benefits like Medicaid or anything like that, we will need that information as well. Your Medicare card, we will need your Medicare card, and your insurance card, so we can compare. So when we give you the comparison report, we will say, okay, your current plan is changing your copays on medication for next year. Also, it should have been at the beginning of September and mid-October that each of you should have received a detailed plan information for next year. So they should be able to provide you every year with any changes that are gonna come for next year, and if you're not satisfied with that, then you will kind of shop around.
Is that the big book they send out?
Yes,
Yeah, I don't read that.
me
So,
either.
so what we will do is, and of course, a list of hospitals and doctors, if you're very adamant that you wanna continue to see your doctors. If your preference is your current doctors, then we will need that list. Because if you're going to switch to a Medicare Advantage plan, we might be able to tell you if the doctor is within network or it's not. We will help you, we will guide you through that. What we do in NCAA is that even if you think you're satisfied with the plan for next year, you can just look. We can set up a meeting and we can just go into the Medicare Plan Finder tool and we can see if the plan will work for you moving forward, or we will provide you options if it's not.
Do you do this in person, or is it over the phone?
We
or
could do
Zoom?
it in different variety of ways. We can do it in person, we can do it over the phone, or we can do it right now through Zoom meeting or anything like that. So as long as you provide the information that I mentioned, yes, we can definitely do it.
And then one last question is, so, and just help me understand if I'm correct, okay? To find out what I'm actually paying for all of this insurance, it's an annual cost that we pay once a year in January, I think, and then a monthly, and then something comes out of Social Security, right?
Okay, so it depends on the plan. So most plans, if you go with, have monthly premiums. Most Medicare Advantage plans don't have them. That's why individuals who don't have chronic health conditions go with the option with a Medicare Advantage plan, because they only pay when it's necessary, when they go to the primary doctors or when they get some x-rays or lab work done. However, usually they have like the prescription cost of it for the plan. There's a deductible. There's different deductibles when it comes to Medicare. So there's hospital deductibles, there's doctor's deductibles, there's prescription deductibles. The Part A hospital deductible, it's per benefit period. That will mean spell of illness. So if you fall down the stairs and you have to go to the doctor because you broke your hip, you get surgery, then you are discharged to the skilled nursing facility, then you're discharged completely home. 60 days pass, day 61, there's something in your living room and you kind of like slip and fall and injure the same, but you go back to the hospital, a new spell of illness will come in. So the deductible for Part A will be, again, for 2023, it's $1,600 per spell of illness. Some Medicare Advantage plans might have different deductibles for that. For Part B, the deductible is $234 if I'm not mistaken, or $38, but that is only once a year. And then after that, Medicare pays $80 and you pay $20. For prescription coverage, the deductible can be a maximum up to $500. It's a maximum, so that's the maximum that any plan is allowed to stipulate as a deductible. However, not every plan has it. They have between $100, $150, or $300, and then consequently, there's going to be split of what the plan is going to pay and what you're going to pay. So it's a little bit confusing because there's so many deductibles prior to the plan paying, compared to if you had like employer coverage. It wasn't like that. With an employer coverage, you just had a $5,000 deductible and everything applied to it. When it comes to Medicare, it's a little bit tricky because each part of Medicare has a deductible, so each part will come with a cost. The money that is deducted from your Social Security is Part B premium. Individuals who work at least 40 quarters, a total amount of 10 years, Part A is free. However, if you did not work, it can be costly because between 0 and 29 credits, it's $457 a month. And then if you work between 30 and 39 credits, it's $247, if I'm not mistaken. So, but still, it's costly. Right now, if you're only paying, the premium is $170.50, it's going down to $164.50, starting January 1st, but it's deducted because it's for the Part B premium. There's a lot of costs associated with it. I say that all the time, you know, we pay a lot of money while we're working for Medicare. And then unfortunately, healthcare is very, very expensive. I personally have experienced it. My daughter, she has medical conditions and just co-pays and deductibles. And honestly, after we work so much, we get to age 65, we don't wanna work, we wait until 67 to get our full social security, retirement benefits, and then we don't enjoy it. We have to, you know, I say we because I've been doing it for so long, I feel like I'm part of the not enjoying it since I hear so many stories, because unfortunately, there's a lot of cost with it.
Thank you.
Okay, in the back?
Two questions. One is, if you have a Medicare Advantage plan, it says one of the disadvantages is if you have a $200 pocket at a certain point. Can you buy a supplemental for a Medicare Advantage plan, number one? Number two, if you're still working, your company offers you health benefits. When you turn 65, what do you do?
Okay.
Urania, can you, yeah.
Yeah, I was gonna.
Thank you.
So, he wanted to know, about advantages with Medicare Advantage plan, and the cost, and if you can have a supplemental policy for the Medicare Advantage plan. And then his secondary question was, if your employer, you know, provides you coverage after, while you're employed, if it's necessary to have, insurance through Medicare. So, to answer the first questions, no, you cannot have a supplemental policy for your Medicare Advantage plan. It's either or. Either you have a supplemental policy with traditional Medicare, or either you have Medicare Advantage plan. However, if you contributed to a health savings account prior to being on Medicare, you can utilize that health savings account to pay for those co-pays and co-deductibles and co-insurances. You also need to have in mind that you need to stop contributing to the health savings account 6 months prior to your start date on Medicare, in order to be able to get on Medicare, and utilize it. When it comes to employer coverage, as long as you're actively working, you're not required to have Medicare. You can have it as an option if you want to have Medicare as a supplement to your employer coverage. And if you don't enroll, you're not gonna incur any penalties, late enrollment penalties. So, as I mentioned, for prescription coverage is a 1% per each month. However, for Part B, there is a late enrollment penalty of 10% of the current Part B premium for each 12 months, period. So, that can be avoided while you have employer coverage. So it's up to you. However, some employer coverage make specific determinations when it comes to your spouse. So if you're currently working, your spouse turns 65, but she is under your insurance, or he's under your insurance, he can continue to keep the active employment and not be penalized in the future. However, you have to talk to the human resources, because sometimes human resources will continue to have you, since you're the employee, in their policy after you turn 65, and they will not require you to have Medicare as primary, but they will require that for your spouse, because it's not the actively employee. So those are the things that you have to discuss with your human resources department, and they will give you the specific details on your situation.
Is that good? And, yep.
Are there any plans, public or private, that provide benefits for home care provided by family members or non-licensed caregivers?
Insurance companies, no. Like they mentioned, insurance company, it comes to Medicare, so Medicare will only provide skilled home care. That will be privately paid. However, the state of Connecticut has some programs that, it depends on the circumstances. There's one program that will pay a family member for taking care of a caregiver. However, at the time of the application, they cannot be taking care of them. Yeah, so sometimes we have individuals who unfortunately had to quit their job to take care of their mom and their dad, and they want to apply, but at the time, you know, the parent resided at their home, so they don't qualify. Our agency has what is called the National Family Caregiver Support Program and the Respite Care Program. These are programs funded by the state and the federal government that provides grants. So, during the fiscal year of July 1st to June 30th is one, and then the other one is October 1st until September 31st. You might be able to get some dollars that the agency will pay if you qualify for it, to provide in-home services or provide somebody to come and provide the services through another agency. There's also the option, if the individual he can self-direct his services, the individual can choose who our agency pays to provide that. However, we're nonprofit and the fundings are from the federal government and the state, so we have limitations on what we will pay. It's like, if you're traditional Medicare provides what it's, Medicare assignment, it's exactly what it will be covered and what they're gonna pay. They're not gonna pay more for that services. Our agency works the same way. So the program also connects you with these agencies that provide that, and even if the individual doesn't qualify for our agency to pay for it, the benefit of it is these agencies have a contract with us, so their fee, it's different when you're privately paying, so it's a little bit lower, even if you don't qualify for the program, but we match you with them with the program, you're going to be paying the prices that we pay instead of paying the privately paid prices.
Is there an income requirement?
Yes, all programs have income requirement. However, the caregiver program, a caregiver has to apply for you. You cannot apply for yourself. So it could be an immediate family member, but if you don't have anybody, just a neighbor that keeps watch on you on a daily basis or just comes in. It's because as a caregiver, we have to track that, but the caregiver's income and information does not count towards eligibility. It's just the individual's information.
Okay.
Yeah, I have two questions. I have, for the last 15 years, Medicare and Cigna as a supplementary, and it's through the city of Meriden. And just a few days ago, I got information from them in a booklet indicating that we're going to go on Medicare Advantage. I guess they can do that, and we don't have a choice. It just different. So Medicare Advantage, it covers A, B, C, and D?
Yes. Medicare Advantage plan will cover all the parts of Medicare. So we'll call hospital, doctors, prescription, and supplement.
And it's through Blue Cross. So you said that they manage the plan.
Mm-hmm.
Should I be concerned about this?
I will say this. You're a city employee, you're getting state benefits. Either if they have the supplemental or they go with the Medicare Advantage plan, whatever option they choose, it's the best option.
Okay.
The state benefits are the best benefits you will get, and I will say this for anybody who has state benefits and is considering to switch to Medicare because their policy from $200 now is $300 a month. The state benefits are very, very good. You only pay the premium and they pay pretty much everything else. In some cases, they pay the premium as well. If you switch to full Medicare just because your costs are gonna be more than just keeping the state insurance. So I will say this, state insurance is the best insurance to have. Please make sure that before you make a decision, you can contact Choices and we'll tell you that again. But if you have state insurance, it's good for individuals on Medicare. It's the best.
Okay, well, ours is through the city of Meriden, so it's not state. But my question, all of a sudden I just got this information. So like I said, I guess they could do whatever they want.
Yes.
Okay, the other question I have pertains to long-term care insurance that my husband and I have, and we had it for like 25 years. And we have the plan where, I guess for the first 30 days we have to pay, and then the long-term care kicks in. And I was under the impression that if you think you need long-term care, that your doctor has to recommend this to the long-term care insurance company before you can actually get it?
Okay, so I'm not very knowledgeable on long-term care, because
Okay.
we work with the state, so I'm gonna let one of, yes.
I can answer your question.
Yes.
So with long-term care insurance, Tully had mentioned an elimination period, which is those 30 days that you were talking about.
I would be responsible for that.
Correct, but then after that, they would cover at 100% up to whatever, X benefit that you have, your maximum benefit.
Well, mine is forever.
Perfect, great, wonderful plan. So from there, yes, typically, for example, let me use an example. We have a patient on our post-acute unit, they decided they're gonna stay long-term. Our physician would need to sign a form certifying that yes, indeed, they do need long-term care, so yes. Even if you're admitting from the community into a long-term care facility or even into assisted living, they do need a letter of medical necessity in order to access that plan.
Okay, and I was also under the impression that somebody told me that they try to keep you in your home too.
They can, because, obviously, a lot of times these insurance companies think home is best because it's less they have to pay.
Right, like
They don't wanna have to pay out, and that's always unfortunately my thing with insurance is they don't wanna pay if they don't have to, so. However, that's where you go to your doctor and you build that relationship with your doctor. And if you're really needing long-term care, or even like I said, assisted living, and they sign off on it, the long-term care policy has to go with that. Go with the word of your physician.
Okay, and like you were saying, the price of long-term care
It's
has
going
really
up.
skyrocketed.
It is.
And like I said, I've had it for almost 25 years and seen the change in the price and everything, but from what you told her, I should keep it.
I would recommend keeping it,
Yeah,
yes.
okay.
I always recommend keeping long-term care insurance because again, it's insurance, you never know when you're gonna need it.
Exactly.
And if you do need it, you have peace of mind of knowing everything's taken care of.
Right.
It's less of a burden on your husband, your family, just that peace of mind, I think, and that's a big part of it too.
Okay,
is
it's good to hear that, thank you.
Yep.
So, just since there's been a lot of questions about regular and Medicare Advantage, to me, the biggest difference is the Advantage plan. They pretty much control your doctors and where you go, and you have more flexibility with regular traditional Medicare and supplemental. So if you get some kind of diagnosis and you want to go to Boston or New York, you have that more flexibility, where the Advantage plan says, you gotta go here to Hartford Hospital or whatever. So that's the major difference beyond Medicare with supplemental. It's gonna cost a little more, but you're paying for the luxury of being able to wherever you wanna go.
Yes.
Does that also include if you travel and you get ill outside the country? I thought I saw something too, sometimes Advantage doesn't always cover that, but traditional with supplemental sometimes does.
Mhm.
I don't know if you've heard that, or I hope people consider that with traveling, but it's something to think about.
Yeah, absolutely.
Yes, so, the difference, you're correct. It's pretty much that Medicare Advantage, it depends if you have an HMO, you're more restricted to those doctors. So there's two kinds of Medicare Advantage. There's the HMOs and the PPOs. HMOs, their network are more restricted. PPOs, they refer to it as you can choose any doctor, but that's not accurate. It's just that their network is more broader, so
Okay.
they have more options for you. But it doesn't mean that you can just, because if you live in Connecticut and you wanna go to a doctor in Ohio, I don't think it's gonna be covered, despite the fact that individuals consider that. When it goes to foreign travel, yes, some Medicare Advantage plans go by the Medicare rule, as of only if it's an emergency, it will be covered. Supplemental policies, some of them, depends on the plan, do have the travel option for you to cover.
Well, it's considered because we live near the Mass border too, and I know, a lot of times that, we have a son who's on Medicaid, and that, you can't go over the border.
Right.
You gotta stay here in the
Different
state.
rules.
So if you don't, you gotta think about it. I just know there's a lot of questions asked about the Advantage plan, so I just wanted to highlight, that's one thing I've heard. You don't have the choice, and if you wanna start seeing a doctor maybe out of Bay State, you may not be able to. Okay.
You can still see a doctor, however, it's not gonna be paid for. You're gonna have to pay it out of pocket.
Right, okay.
And unfortunately, that's something that we're not looking for because, you know, if we can, you know, and.
Covered is better.
Yes, if we can have it covered, yes, absolutely.
Yes, exactly, yeah, okay, thank you.
Any other questions? Well, thank you so much. Let's give a round of applause. Thank you so much for coming out. Remember, there's collateral. If you could leave your surveys, we would really appreciate that. And don't forget, next month, December 8th, we're going to do a day in the life of a resident in assisted living. And we're going to have internal people here from dining, a nurse, director of nurse, and director of life enrichment. Thank you so much for coming out.